Welcome back to Smile Jamaica. It's now time for 10 minutes to your health. And today we'll be looking at navigating fibroids during pregnancy. We have here with us Dr. Adrian Mitchell. He's a medical doctor, gynecological oncologist at the University Hospital of the West Indies. And he's going to be walking us through the concerns and fears that expectant mothers may have when diagnosed with fibroids during pregnancy. Good morning, Doc.
Good morning. Thanks for having me.
Welcome to Smile Jamaica. It's morning time. Oh my gosh. If I could give you $1 for all the explanations and definitions of what people think fibroids are, I think we're becoming a little bit better at it. But before we even get into the conversation, what are fibroids? When I say fibroids, what am I talking about?
So fibroids, in short, are non-cancerous growth that appear on the uterus. They're calcified masses, and they can appear at different parts of the uterus. You have them in the body of the uterus, the tubes. Sometimes it can be at the cervix, sometimes coming through the vagina. But the big message I want to give people is that it's non-cancerous. But all the same, it comes with its complications. So though it may not cause you to die immediately, it can cause complications for your lifetime. And as we're directing today, especially for pregnancies.
What do you know what causes them?
Well, there's a school of thought that is mainly genetics. And we as a populace are predisposed just by our ethnicity. So you find that Black people, African, Latinos are more predisposed to it than Caucasians. And then there's a genetic component. So you find that if there's a family history of fibroids, you are likely, as a second generation, third generation, to get fibroids, yeah.
All right. How prevalent are fibroids in Jamaica? Let me stick with my own little country.
Well, it's hard for me to say how prevalent. I can say it's common.
Okay.
Worldwide, you're looking at maybe about 40 to 80% spreading throughout the world. But here in Jamaica, I think if I was going to make an estimate for each patient I see, I say maybe every 3 out of 10 patients are coming for a complication of fibroids to me. Yeah.
And that's when it's a complication.
Yeah.
So we may not even have a number of those who may have, and because there are no complications, they're not even sure that they have fibroids.
No, and they silently sit down and leave it alone.
All right, so let's address some of the potential risk and complications that it may have. This morning we're talking about women during pregnancy.
So the first thing that I would say is that if we start before pregnancy, I mean, obviously it can complicate your period, might make it all heavier, painful. It can make you have incontinence, which means that you accidentally wet yourself, or it can make you have difficulty passing your stool. Some patients actually have horrible pains during the cycle. But when it comes to pregnancy, one of the biggest problems we have in the first trimester, which is the first 12 to 14 weeks, is that you get a lot of spotting and bleeding. Now, arguably, it may not cause a pregnancy loss, but it can cause the pregnancy itself to be complicated. Now, when you hit the second and third trimester, the bigger problem that we have with a lot of patients is pain. Pain. So sometimes you have to be admitted to get rid of the pain. So yes, you have painkillers that you can take during the time, but unfortunately, what a lot of patients don't understand is that fibroids will go throughout the pregnancy, so they'll get even bigger. So you find that you have completed the pregnancy and have gotten bigger than when they started.
Yeah. So what kind of impact does that have on the baby? I mean, the baby is growing, so is the fibroid. Well, there's the pain.
I would tell patients and I reassure them that most of the times the babies win. The biggest problem we'll have is you're going to have the fact that you can go in premature labor. You can have heavy bleeds during pregnancy. And to another extent, the fact that the mom is being hospitalized so often, that can also increase our risk for infections at the hospital. But the babies tend to be, most of the time, they're fine. They grow and they play with the fibroids, they move around, yeah.
But it's important during that time to do regular monitoring of it, though.
Correct. So you're going to find that if a patient is pregnant with fibroids, the doctor may actually increase the intervals or decrease the intervals that you're going to do the ultrasound. So you may find that instead of doing 3 ultrasounds in the pregnancy, you find yourself doing 4 or 5, depending on what's happening. Now, one of the biggest things that we tend to do as doctors is find out if there's a fibroid blocking you from having a natural birth. So if the fibroid is lying low in the uterus, it may actually prevent the baby from coming out through the vagina. And also, you find that if you have to do a surgical procedure to deliver the baby, we may want to find out where the location is, because that helps us to plan our incision and also plan who we may ask for help. Because you find that if they're really large, which we've been seeing in recent days, you may want a senior doctor with you to kind of say, hey, help me to navigate this, because we may have to remove a few during surgery.
Oh, wow.
To get out the baby.
To get out the baby?
Get out the baby.
Oh, my gosh. Because one of the things that I'm thinking now is once pregnant, I think you just at that time will just have to determine that you're going to figure out how to navigate the fibroid until the baby is born.
Correct. So we can't really treat fibroids in pregnancy, and patients have asked, can you treat it while I'm there?
Yeah.
Currently, no. In our populace, no. But there's technologies coming out that maybe in our 10, 15 years, this will actually make a difference. But unfortunately, it's something that you have to wait until after you've concluded the pregnancy to kind of fix, I would say. Yeah.
So the best case scenario, therefore, is to determine, if you're planning on having a child, is to determine whether or not fibroids may be an issue before becoming pregnant.
Yeah, you have a good point, but let's be frank. Do we really plan most of the pregnancies here in Jamaica? We're supposed to plan, eh?
Yeah, we're supposed. That's why I said best case scenario.
Yeah. But I hit back at the biggest point, which is see a doctor regular, have yearly checkups. I mean, at least a woman in a lifetime should be seeing her doctor once a year to have her pap smears done, to have her checks, and that can help with a little bit more of the pre-planning or the spontaneity of a young one joining in life, because that now allows the doctors to say, hey, there's a fibroid, we're going to monitor it, and if it gets too big, they may say, hey, let's take it out from now since you're planning now to get pregnant. But those tends to be the best time to deal with it.
What are some of the most common myths you've heard about fibroids?
Wow. The biggest one that is spreading throughout, and that's social media, which is the fact that if you eat certain products, it will cause you to generate fibroids. Now, I would say it doesn't cause you to generate, but it causes them to get bigger. Okay. Some people believe that people obey you, which is also, I would say unlikely. It's more mainly genetics. And some people believe that they're punished from their past lifetimes. That's something people come back and say, boy, I'm boiling on my uterus. And I think, say, boy, my granny do this to this lady, so that's why we have it, you know? Because the whole of our family has fibroids. Wow. But I reassure women that, you know, really it's genetic. That's the main reason. And unfortunately, we don't have a prevention strategy to not make fibroids grow. It's really monitoring. And if it gets too big, we kind of just remove them for you.
I know you addressed this at the top of it in terms of having the fibroids and, you know, the possibility of it affecting the health of the baby or having miscarriages. There are some women who believe that it is difficult for them to get pregnant because of the fibroids. Is that also a possibility?
It is very much a possibility. As a matter of fact, with the fact that patients are a little bit more fearful of doing surgeries, I've been seeing a lot more fibroids actually blocking the tubes. So you may actually, I wouldn't say fibroids cause infertility, but based on their position, they can actually block the tube. So I've seen them right there where the baby and the sperm should meet. And unfortunately, when we actually remove the fibroid, we can't really repair it because it's done so much damage in stretching it.
Already.
Yeah, so, you know, I tell patients all the time, it's not necessarily the size that causes a problem, it's also the location. So, you know, I urge women, especially those listening, just go check your doctor, please. Because I've seen other women now having to now take the next step, which is going to be in vitro fertilization, where what we call colloquial test tube baby. You have to now go to a specialist and have the baby transferred in you because your tubes are gone. So, I mean, I would say the biggest thing is that, yes, fibroids can cause you to have problems getting pregnant, but not traditionally, not most times. It's coming up now, it's becoming more prevalent. The longer
are we seeing, because now, I mean, the Ministry of Health has launched a Know Your Numbers campaign, and one of the things they're discovering is that younger people are coming in with non-communicable diseases that we used to think is only older people have.
Wow.
So we used to say, oh Lord, high blood pressure and diabetes and them things is older folks, but younger people are presenting. In terms of fibroids, are you finding a particular age group presenting? Yeah,
you're finding women between 25 and 35 coming with fibroids now, and I'm finding them to be even bigger. So my big question to myself is, what are we doing different? And if you ask me, I think we're not kind of growing what we eat. We're eating a lot more of the processed foods, and I think that may be having an uptick. But that's just my observation. It's not medical. It's not. It's
no
not
data yet to support. But it is concerning that age group and much bigger is what I am also seeing. Like I've seen some fibroids that look like children.
I've seen people actually come in and think they're pregnant. Because of the size of the fibroids, and then you alarm them and say, there's no baby in there, you just have a couple of big fibroids. So I mean, yes, they're a lot bigger, and I mean, they do complicate surgery, and sometimes you may find that patients come in for just removal of the fibroids and we have to take out the entire womb. And you have those that have the fertility desires. So I stress to women, just get them out from early.
Yeah, to me it sounds also like it requires a lot of support, you know?
Yeah.
Emotional support.
It does. I would say in a sensitive way, Going through fibroids is a bit rough, and having pain associated with it, and having somebody to lean on, to be there, to carry you to the doctor, necessarily get you the right treatment, even rub your tummy, give you a nice warm bag on it. It does help a lot. So yeah, I do agree. Support does matter.
All right, Doc, thank you so much. Biggest takeaway, ladies, go see your doctor, please. Thank you so much.
Thanks for having me.
Dr. Adrian Mitchell, medical doctor and gynecologic oncologist. That's 10 minutes to your health. We'll do it again next Thursday.